One of my favorite movies is The Verdict with Paul Newman. I love the scene when Paul Newman realizes he can finally prove that the defendant doctor altered the medical records of the lady that he left in a coma as a result of his negligence. Now, altering medical files does not happen as often as it seems to happen in the movies or on television. But it happens enough that experienced medical malpractice lawyers develop a sense of when further investigation into the legitimacy of the medical records needs to be investigated. For example, I've been involved in the last 18 years in a number of cases that have taught me some lessons about when to look for evidence of altered medical files. In one case, my client, the patient, had been seriously injured after taking medication. The nurse's notes indicated that the nurse had talked to the patient's doctor and told the doctor about the patient's deteriorating condition. But when we checked the timesheets and shift records for that day, it turned out that the nurse wasn't even working on the day that she supposedly wrote those notes. So I've learned, in cases where the records are suspicious, to investigate all of the records, the timesheets, shift schedules, in order to determine that everybody that says they were there actually were there. In another case we were involved in, the doctor actually tore up the records and created a new one that he placed into my client's file. Now, one of the nurses saw him tear up that record, scotch taped it together, and kept it in her locker. What I learned from that case is to interview everyone that was involved in my client's case to see if they have any information that may help my client. In another case I was involved in, a birth injury case, the child's APGAR scores. An APGAR score is a test of how healthy the baby is, and the baby's APGAR scores had been changed from a 0, which is bad, and whited out and changed to a 2, which is normal. And that whiteout, that change, wasn't evident on the photocopies that we received from the hospital. But the readings were suspicious, and I made an appointment to go to the hospital to take a look at the original chart. And that's when I discovered the whiteout and the change that had been made to my client's records. So I've learned, when the records are suspicious, I make a special trip to the hospital to view the original record. Altering medical files isn't something that happens in every case. It isn't even something that happens in most cases. But as an experienced medical malpractice lawyer, I've learned what the red flags are in order to determine whether further investigation is necessary.